What is the common menopausal age these days?
Okay, so here, once again, the menopause is not a definite thing, is not a fixed thing for every woman. Any woman who gets a menopause earlier than 40 years, we again say it's premature menopause. And any menopause which happens after 40 years is supposed to be a normal thing. But it all depends upon your genetic makeup. Some women might get a menopause at 42, while another woman might go up to 58 also. It depends upon your ovarian reserve and how well are you taking care of your eggs, which means once again, eating good food, making sure that you're not suffering from any lifestyle diseases. There are few things which are beyond our control. Somebody's diagnosed with a malignancy, and this is something which is beyond anybody's, by and large, control. But uh, it's important to look after yourself. And I also said that women are these days losing their eggs faster because of multiple environmental factors all around us. Now, if there's pollution, you can't help it. I mean, you have to breathe in that air. Can't help it. If there's a vegetable coming to you, however much you wash it, you can't be really sure that it
Correct.
is completely free
Completely
from
correct.
the pesticide or the herbicide.
You can do whatever you can from your side.
Yeah, but there are a lot of factors which are beyond your control. You can control your smoking, alcohol, making sure that your diet by and large is good, taking care of your stress factors, but still there would be some factors. So, menopause, I tell people, is that number one, never get scared. I mean, it's a natural transition of your age, and I take it like this: it's a wonderful phase. You should celebrate the kind of wisdom you have acquired for so many years, and the very fact that you raised a family, you've brought up your children, you've come this far with a single or a multiple partners or whatever. But it's a time to take pride and look back. So never get scared. But this is the time when women should be even more careful of their health. The biggest thing which a woman faces actually are two things. One is the risk of osteoporosis, and second is a cardiovascular risk. So the estrogen is a hormone which protects your heart and it protects your bone. So strength training is once again a very, very important thing for every woman. Number
Strength
one,
training increases estrogen, helps in strength training.
no. Once you go into menopause, you need to be strengthening your bones because now there
There
is
is no
no
estrogen.
estrogen to protect your
Protect the
bone. And of
bones.
course, when you do a good strength training, you have good muscles, you have good, joints, your heart is good. So you benefit everywhere. So I always tell this to my patients that, it's important for a woman in 45 age group to exercise more than a woman when she's 25. Of course, every woman must exercise. But now you need to be even more proactive. Make sure that your diet has vitamin D, has calcium, and make sure that you have less inflammation in the body by reducing your stress, reducing your cortisol. We know inflammation or high cortisol can cause bone loss. So there's everything is interconnected. And once again, it comes to move your body, eat little less, and be happy.
So you recommend more strength training around the age of 45 when they have menopause.
Absolutely. And Dr. Paul, I started strength training 10 years back. Like I'm now nearing 60 and I
You're
will
60.
be,
You don't look like
yeah,
you're 60. You look so young.
I'm nearing 60. But it's been, for me, the menopause has been the best phase of my life. I've done the best in my life after my menopause. I've been at the best stage of my fitness after my menopause. So, and I'm not just saying it, I wish some people get motivated by listening to this, that never give an excuse that why can't I do this. I mean, all of us have our own excuses, as doctors also, we're working late, this, that, but never give an excuse, because when you give an excuse, you're actually fooling yourself, because your health is your responsibility. It's nobody else's.
Of course. What kind of strength training that you do?
So I do it with weights,
Weights.
bands.
Bands.
Yeah. So I'm a yoga teacher. So I do practice 4 days yoga and I do 3 days of strength training too. So I practice. I miss only if I'm stuck up in a hospital.
Oh my God. So you are a busy surgeon, busy OBGYN, clinical practice. You are active in YouTube, social media, and you find time to do strength training.
No, this is like an attempt to make sure that my body is in place. and I think every woman must realize this, that you need to do it for yourself. I mean, in my family, everybody knows that 1 hour, they can't disturb me. I mean, I've set those boundaries that you need to do this. And for every woman who's watching this, they must be selfish when it comes to their self-care. It's very important. Very, very important. And why not? I mean, why a man can go to exercise? Why can't a woman do this?
Of course. And they are working a lot more with
Yes,
the family.
absolutely. So it's very, very important. And like I said, eat simple, eat less.
You don't need that much. You don't need, your body doesn't need that much.
Exactly. And unfortunately, we all eat much more than what we are supposed to eat. Then on top of that, we eat wrong things. Then on top of that, we eat at wrong times. So फिर बेचारी body क्या करेगी? The body is going to collapse.
So, I mean, you are doing yoga, you're doing strength training. You look much younger than your age, for sure, of course. That is the living testimonial that, people can follow you and then, have a very good menopausal life.
Yeah. So I would say, fortunately or unfortunately, I had an early menopause when I was 41. So it's been now 18 years. And I've been surviving.
Yeah. What the hot flashes that comes around menopause, right? Is it a common thing that affects everybody?
It does. So it's, once again, it's not, I would say, it's not a very uniform thing that every woman will have hot flashes. It varies from person to person. And why does that happen? Is because the lower estrogen levels somehow disturb the thermostat which is present in our hypothalamus.
Thermoregulation.
Yeah. So for some people, it could be, really bad that they are not able to work and they're constantly with the fan. And, there is something known as a night sweats. So, people wake up in the middle of the night. So
just sweating.
Yeah, just sweating.
I had a patient, she has to remove the whole t-shirt.
Yeah.
Because she just completely
sweat. So, some people have it more, some people have it less. But I would say, I always tell my patients is that, first of all, don't get worried. Nobody dies because of a hot flash. So don't get worried, oh, doctor, this is, I understand it's a problem. But typically, we've seen within 2-3 years of starting the menopause, now the body gets used to lower levels of estrogen and sort of makes peace with it. Ki ab yahi hai, I can't get more estrogen than this. Let me be happy with it. So till that time, do whatever makes you comfortable. It could be wearing your clothes in layers and making sure that you exercise, follow a good diet. And in case nothing works, there is a small subset of people wherein we might need to put them on HRT for some time. There are proper guidelines for putting a patient on HRT. So
hormone replacement therapy.
Yeah, hormone replacement therapy. So, there are proper guidelines like who should be put on. So
doctor will decide.
Yeah, let the doctor decide. Please don't ever take a medicine just because my friend is taking or my sister is taking. HRT comes with its own risks, including risks for the endometrial and the breast cancers. So it is a decision which you must take after talking with your doctor.
Is HRT available in the pharmacy that anybody can buy here in India?
Unfortunately, in India, in case you have your friend's prescription with you, you can take your friend's prescription and buy an HRT.
Same
which
dosage.
Is sad. So here, you have your friendly chemist and a friendly pharmacist who is ready to oblige you.
Wow. Because it causes blood clots sometimes, right?
Yes, of course. So that's why I said there are the decision for HRT has to be taken after a detailed discussion with your doctor, because the doctor is going to evaluate your medical condition. If you're obese, if you're a smoker, if you're a diabetic, if you're at a risk of any form of DVT, of
Correct.
course,
Blood clot
that may not be a good
formation.
option for you.
Exactly.
So there are multiple things which can be done, for hot flashes. And in case nothing works, HRT is there. We can put you on guided HRT with a proper monitoring. This is very important. So don't just take an HRT because somebody else takes this pill.
On your
So
own. Yeah,
never
on your
do
own.
that.
The other problem in this menopausal group is the osteoporosis. And you said that estrogen is the key thing to maintain the muscle mass and bone and everything. And since after menopause, estrogen has gone down, so you are at increased risk of bone loss. Do you recommend DEXA scan or something?
100%. 100%. Every woman must undergo a DEXA scan. Fortunately, these days, with the era of preventive health investigations, a lot of people are now doing that. So, with the blood investigations, you get a DEXA also done, a mammogram also done. So, it's a good idea. Please
Get
do
DEXA
that.
scan. DEXA
Get a
scan,
DEXA
how
scan
often should we get it?
annually.
Every year.
Every year.
After
Every
40,
year.
after menopause.
After 40 years, an annual health examination is required. And in case your DEXA scan is showing osteopenia, it's important to be in a regular touch with your gynecologist and orthopedician to make sure that in case the scan is to be done even more frequently, then it should be done. So it all depends upon where your parameters are. And there is a proper,
recommendation, protocol.
protocol. There are a lot of drugs which we give in case we find that the person is grossly,
You
osteopenic.
give calcium, vitamin D supplements.
All that. That is very
basic
Then,
thing.
of course, we have a lot of other drugs like bisphosphonates
Correct.
and other things also. So, but then I don't want to say the names so that people should not just think, oh, this is a drug I should buy. So let that decision be
Maybe the
taken
doctor,
by
yes.
a doctor.
Of course.
But understand that osteoporosis is reality. It's much more commoner than what we think. And unfortunately, in our country, I don't know what happens in US, it is diagnosed when a woman has a fracture and she comes, with a fracture, and then a DEXA scan or X-ray says, oh, she's grossly osteopenic. So please look after yourself. And smoking is one reason which causes osteoporosis.
Of course. I'll tell you an example in the US where there are two patients had. One patient had a hip fracture and the other patient had a knee strain or something. Both had osteopenia, osteoporosis. One of the patient is from an Indian immigrant, came from India after 20 years. And the other one was a white female who was there. Both had same age, same menopausal symptoms, but the white female got recovered much faster and from a knee sprain.
Okay.
Same kind of fall.
Okay.
Then I was telling I was involved because of fatty liver and everything. I was telling the person from the Indian community is that, see, the problem is that the other patient had a muscle mass protecting the knee.
Yes.
In your case, you were 46. We didn't focus on the muscle mass at that time by strength training. Let's say you would have done strength training, built some muscle mass from 35 to 45, the recovery rate might have been much easier.
So it's like, once again, it comes to this, please move your body.
Movement is big time. And hip fracture is the main thing, correct?
Yeah.
Elderly.
Yeah. Fracture neck femur.
Fracture from femur.
Neck femur.
Neck of the femur. And it can be very
debilitating. Very debilitating. It has a very, very stormy course also. So make sure that you don't reach that place in the first place.
Hopefully, audience will listen to this, do some kind of strength training, and will not end up in that situation. The other thing very important in this field is bleeding. After menopause, there should not be any bleeding.
100%.
Right? If there is bleeding, you should seek a medical attention right away.
Absolutely. So, any bleeding post menopause is not normal. So, first of all, what is menopause? So, which means for 1 year, you haven't had your periods. Now, we officially declare you've gone into menopause. After that, any bleeding is abnormal and should be immediately reported to the doctor because of fear of malignancy.
Malignancy. Mm.
Period.
It's endometrial cancer.
Yes, endometrial cancers.
It's a possibility.
Even cervical cancers and everything. Cervical cancer, of course, all these things can happen in a premenopausal age group also. But post-menopause, any bleeding, please report to the doctor. And these days, going for a preventive health checkup is a good idea. Many times we pick up a increased endometrial thickness on an ultrasound in a post-menopausal woman. So in case, before she has a bleeding episode, we pick it up then and there only. So if you can afford it, please go for an annual health checkup.
And you biopsy the endometrium?
Yes. So supposing in case, postmenopausal bleeding is an indication of a hysteroscopy
Hysteroscopy.
and endometrial sampling. And in case on the ultrasound something is coming, which means that your ET looks thick, or in case we see some growth inside the endometrium, inside the uterus, of course we do the hysteroscopy and the endometrial sampling.